I know there are.
Oh, we're live now. All right. Good evening, everybody, and welcome. I would like to welcome you to an information session that we are having with Public Health Sudbury District. My name is Larissa. I am a Bluecoat at Science North. And with me, I have Carly McGibbon, who is a registered nurse with Public Health in the vaccine department. She's been with them for 17 years, and she specializes in children and school-aged vaccines. Welcome, Carly.
Thank you.
So before we start the session, I would like to do our land acknowledgement. So as settlers, we wish to recognize the ancestral lands of the territory of the Robinson-Huron Treaty of 1850. We respectfully acknowledge the communities of Atikoshang, Anishinaabe, and Wampanoag, on whose original territory we have the privilege of presenting from today. We would like to take this moment to thank and honor the people, families, and elders of these communities who have made this their homeland and whose enduring presence is felt to this day. What we're going to do is we are here to give you a brief presentation on vaccines and the development of the vaccines that we're using for COVID-19. And during that presentation, I will occasionally be asking questions of Carly that the public health unit collected through surveys. So we had some surveys that went out and some frequently asked questions. And when I see sort of a slide that relates to some of the questions, I'll be asking Carly some questions and she'll help answer that. If you have any questions yourselves that as you're watching this broadcast, put your questions into the comment section of the YouTube. And we have somebody that is monitoring in the background, and they are going to put forward some questions. So after we do the actual presentation with the slides, we'll have an opportunity for me to ask questions of Carly that are coming from the audience, that are coming from the viewers. Before we do start, again, with this, I would like to say that we are looking for respectful language. So we will not be tolerating disrespectful, abusive, or obscene language in the comments. As I said, we do have somebody monitoring it. This is meant to be a presentation to give information to individuals about the children's vaccines and vaccination for children who are aged 5 to 11. And we will do our best to answer as many questions as possible during the session, but we do also have a limited time to do this. And we will let you know at the end if we don't get to all the questions, how you can contact either the health unit, or you can also contact Science North, and we will do our best to answer these questions. All right, so if I can just get the slideshow on the screen, and I can actually share the overview of what we're going to be doing. All right, so in Carly's slideshow, we are going to look at the development of the vaccine, how vaccines work, some risks that are associated with COVID-19, benefits of vaccination against COVID-19, how to talk to your children about getting the vaccine, and again, at the end, we'll look at opportunities and clinics that you can attend to get vaccinated. And then the last part of it, we will do our question and answer. Did you have anything else you wanted to add, Carly, before we start on your presentation?
No, I think we're all set to go.
Okay, so I will advance. And like I said before, just let me know when you need me to advance the slides.
Sure.
All right, so.
Okay, so thank you everyone for listening. Like Larissa said, I'm a nurse from Public Health. I've been doing vaccines for a long time. Love COVID vaccine and love that we have the opportunity to protect our kids. And so I'm happy to be here to talk about the vaccine and some few common questions that we might all have. So one of them, of course, is the development of the vaccine. We know that in Canada, all pharmaceuticals that we use, so vaccines, medications, antibiotics, everything has to be approved by Health Canada. And we have one of the most rigorous, strict approval processes in the world. So when Health Canada says something is safe, I mean, we have every reason to believe that they're right. One thing that's really cool is even after something is approved, they continue to test it and they continue to work on it and make sure that, at all points, the risks still do, the benefits still do outweigh the risks. So it's not just sort of like a one and done thing. They keep checking up on it and making sure that, what we think is actually what's going on. So that's cool. The other thing we hear a lot is, holy smokes, this vaccine came out of nowhere. How could they possibly have gotten it ready this quickly? Vaccines take, 10 years to make. So there's a few reasons for that. One is this is not brand new. This did not come out of nowhere. Ever since SARS in 2002, scientists have been working on messenger RNA vaccine. So this is not totally a new concept. It's new to us, but all these great science minds have been working on it for some time. The other thing this shows us is when the whole world is on the same team and everybody's working towards a common goal of vaccine, things can get done pretty quickly. A lot of countries were throwing a lot of money into this project, and with a lot of money and the top minds from all over the place, we see things happen quickly. They also did cut a lot of the red tape. And, this was an urgent situation. And so we were able to get things done quickly, while, of course, still safely. And one of the best ways to explain that is if you were writing a novel. So if you're an author and you're writing a novel, normally what you would do is you would write your book and then you would have someone review it and you would do all these things with it before you ever sent it to publishing. What happened here with the vaccines is they would write a chapter at a time, send it to Health Canada. So every time they worked on something and got it to work, they would send that for approval. So we called this the rolling approval process, in that anytime a little bit was ready, it would get approved and then compounded with the next stuff and the next stuff. So like I said about, all the money and all the red tape being cut.
Do you know when they started testing the vaccines, like when they did the trial runs for the age group of 5 to 11?
Sorry, I don't have the dates off the top of my head. They, of course, with most vaccines and most medications, I think they start with adults. Because when trials are happening, the reason for this is, who's going to sign their five-year-old up for a trial? So there's some ethics around that. And so they start with adults, and then once it's proven safe and effective for adults, we move on to younger age groups.
So they went, and I think they did they started off with the adults, and then they went to the 12 to 17.
That's right. So then it moves down to 12 to 17, and then they moved it down again. So just to make sure that, the data supports the younger children, it's kind of a step-by-step approach rather than just a blanket statement to say, let's give this to everybody.
Yeah. And also with the whole, it being very, the development being shortened, it was because there were so many people that volunteered, they were able to get a lot of data as well too, and a lot of vaccine development. That sometimes is what holds it up, is getting volunteers to get there, right? So.
Absolutely. And I, like I say, when the whole world is on the same team and everybody's working towards the same common goal, it absolutely, and finances are not a factor. And what we don't see with vaccine development is people writing grant proposals and people looking for laboratory space. And when you take all of those factors out and you can focus strictly on the work, things do move a lot quicker.
All right. Do you want to move on to the next slide?
Please.
About how vaccine?
Yes. Oh, I lost you.
Apparently I got cut off.
Okay, there, you're back.
All right. I got to share my screen again, though.
Yes, please.
All right. Sorry about that.
It's okay.
I was told it was not my fault. All right. So how do vaccines work?
Okay. So we know that Pfizer vaccine, Moderna, and pediatric Pfizer, of course, are messenger RNA vaccines. And how they work is they tell your body to make a spike protein. So we see the little pictures, and we have one in the bottom of our screen of these spike proteins developing. And what our immune system does is then learns how to get rid of this. So the vaccine introduces the need for the spike protein, and our immune system learns how to get rid of it. So we're training our immune system to say, if you see this virus and if the real virus comes in, this is how you get rid of it. So a vaccine is kind of like a recipe card, if you will. It teaches your body what it needs to do to get rid of the real illness. It's like a practice round almost, so that your body and your immune system are ready to go should the virus show up in your body.
So one of the questions, I guess, from your survey was, can my child or children get COVID from the vaccine?
So no, so luckily the COVID vaccine, Pfizer, Moderna, the ones we're using, they're not live vaccines. So we're not giving you any of the live actual virus. This is a great question. It's questions we hear all the time with vaccines. So no, it's not humanly possible. It's made similar to the flu shot where, we say you can't get the flu from the flu shot. So no, it's impossible to catch COVID from the vaccine as well as shed the virus. So we hear that as well. If my child is immunized, can they then shed the virus or shed the disease to a loved one? And the answer to that is no.
And also the virus, which is messenger RNA, will not affect the DNA of our cells.
No, so they sound the same, but messenger RNA does not enter the DNA cells, and so therefore it can't affect it in any way or alter it.
All right. We'll move to the next slide.
Please. Okay, so we'll talk about the dosing interval. So at this time, for children ages 5 to 11, it's still a 2-dose series. That's what we know today. What we know with COVID is things change on the daily. So there could very well be the need for a booster in the future. But at this point, what we have is a 2-dose series. So children get 1/3 the dose of adults. They're getting 10 micrograms in their vaccine, whereas adults were getting 30 micrograms. Important to note that vaccines do not go off weight of the person. They never have. None of them do. So we often will get, parents saying, well, my 10-year-old is really large, or, my 13-year-old is really tiny. Maybe they should have the pediatric dose. And the dosing is based off the maturity of your immune system. So that's why it goes by age and not weight. Often, as parents, we think about our child's weight because the doctor's always asking that, or the pharmacy is always asking that for medication. But a little different for vaccines in that it goes by the age of your immune system. So
yeah, I was listening to, I think it was Quirks and Quarks, and they were basically saying that our immune system, even as an adolescent, it starts to decline, and which is why I would assume that the 12 to 17-year-olds were able to get the adult dose because they have a waning immune system already as an adolescent.
And it depends. I mean, all different vaccines have different dosaging at different ages. So we know, at Twinrix, they'll say if you're under 19, you can get the pediatric dose. So it just depends on the product and how the manufacturer has set out the age range. Super important thing to note, though, is we've definitely seen at the clinics a lot of really excited families and really excited parents. I was certainly there lining up with my child. But please don't come if you're sick. We know people are excited. We know people want to get done. We want to vaccinate as quickly as we can and as many people as we can. But what we don't want is ill children at our clinics. Of course, we've been stressing, for ill people to stay home this whole time. The other thing we're running into a lot right now is kids who are being asked to isolate either as part of a school cohort, as part of a bus group, a hockey team. So please do respect those rules. And if your child does need to isolate for 10 days, please complete the isolation prior to coming to the clinic. We will ask you, are you or your child supposed to be isolating? Important for parents to note, it's not like it was at the very, very beginning of the vaccine rollout. We do have a generous supply of vaccine. So it's not a now or never type of thing. If your child is isolating for 3 or 4 more days, please complete that. And we're more than happy to see you when they're, free from isolation.
So on this slide, it was saying if your child has received another vaccine, you need to wait. Can you sort of explain the reasoning behind why we're waiting?
Yeah, for sure. So this is just a precautionary reason. So there's nothing to say that, if your child got a flu shot yesterday and they want to get a COVID vaccine today, the vaccines aren't going to kind of interact with each other. They're not going to cancel each other out. It's nothing like that. Because this is the newer vaccine, what we want to do is we want to really closely monitor any adverse events, any side effects kids are having. So let's say, your child gets an MMR vaccine on Tuesday, and then on Thursday they get a COVID vaccine, and on the weekend they develop a rash. Well, it's really hard for medical professionals to determine, are they allergic to the MMR vaccine? Is this their normal, rash that we would see? Is this a reaction from the COVID vaccine? So that's why. It's just because if there were any adverse reactions, we want to track those very closely. And we don't want to be wondering, is it this vaccine, that vaccine? So we are asking parents 2 weeks in between. So 2 weeks after receiving a vaccine. And then once you do receive your COVID vaccine, please wait 2 weeks before receiving anything else.
Before getting, but not the second dose. So on this slide, it says 8 weeks. So the minimum is 3 weeks. Do you know why they've suggested 8 weeks?
Yeah, so this is a new direction coming down from the ministry. It started with the introduction of the pediatric vaccine, but it's also now for adults. So for adults coming in for dose 1 or dose 2, we do recommend the 8 weeks. And the reason for that is just to give your body and your immune system a little bit more time to make a little bit better antibodies, so that by the time your dose 2 comes around, you're all set. Not to say that the 3-week window wasn't sufficient protection, but as we go and we learn more and more studies are done, they've determined the optimal time is the 8-week window.
Perfect. All right. So we'll move on.
Yes.
Risks associated with COVID. So there actually, one of the questions in the comments was, what are some long-term effects of COVID in children who are infected? And they were asking asymptomatic versus symptomatic cases. So
Sure. So one thing to note when we talk about COVID illness and COVID symptoms, it's so different for everybody. There's no rhyme or reason. I've done some contact tracing work, and we see people who live in the same house, were exposed on the same day, and one person will be incredibly ill and hospitalized, or the other person, is fairly asymptomatic, maybe has a mild cough. So we always say COVID doesn't have favorites. It kind of picks and chooses who it wants to attack, and we don't know why. What we do know is that generally kids don't get as sick as adults, which is a good thing. But I can tell you here in Sudbury, we have had children needing to be flown out to sick kids, because they couldn't breathe. And so that doesn't happen often, but it does happen. And, kids do become sick. For the most part, it's minor illness, cough, fever, headache. Your minor flu-like illnesses is what we see. But with COVID with kids and adults, we also have what we call long haulers. And these are people that, weeks and months after their infection has cleared or they're no longer contagious, they're still not feeling 100%. So sure, they're back to their daily living, but, we get calls from people and they say, like, it's been 3 months and I'm still winded every time I go up the stairs, or, I used to go for a long walk every day and now I can only go half as far and I just get too tired. We've also heard a lot about people with brain fog and they can't concentrate. So all of those kind of things that we don't know, that are just kind of developing. And what I tell parents all the time and families all the time is that, the illness is milder. It's great. But we don't know when it's going to choose to attack a healthy person.
So sort of related to this, one of the questions that came out of your survey, somebody was asking, isn't natural immunity better than immunity from vaccination? So if you actually get infected from the real virus, would your immunity be stronger than if you had the vaccine?
So natural immunity is good. There's two reasons it's not the best. One is because you've had to endure the illness, so that's not great. The other thing is natural immunity doesn't last as long, so it will absolutely wane. We see people who continue to test positive for weeks following their diagnosis, which tells us that an infection is still active in their body, but that will wane quicker. So after our threshold that we use at the ministry is 90 days. So anybody after 90 days is considered non-immune. So that that natural infection will only last with you for 90 days, and then after that you're no longer immune.
All right, next slide.
Okay, so why should your kids get the vaccine? This is the $1 million question, and I'm a parent myself of a 5 to 11-year-old, and so I absolutely get it. This is such a tough one. As parents, we want to do the right thing. You read so much. I talk a lot about, I give HPV vaccine to grade 7 students, and this is a vaccine that also had a really bad rap, especially among teenage girls, and came out when social media came out. So it's information overload for parents, and we don't know what's right, what's wrong, who to believe. Does the whole world have it wrong, but my neighbor down the street has it right? It's really scary, and we all want to do the right thing. So the reason we do it is, number one, vaccinated people, yes, they can still get the disease. Yes, they can still become symptomatic. Yes, they can still spread it. But all those things are much, much lessened. So a vaccinated person who is positive will likely have lower symptoms, will likely not transmit to as many people, will likely recover faster. So that's our main reason, right? Is burden of disease. Get yourself vaccinated. You might still get COVID, but you're not going to be as sick, not for as long, and you don't risk the transmission. We also know about herd immunity. So herd immunity is great for adults, but these little people make up a large portion of our population, and we absolutely want to include them in the herd immunity. I describe it like the rings around a planet. We want to kind of wrap ourselves around our community and build these links of protection around our community. Another thing with vaccines, so as we do that and as we build our herd immunity and we build our protection, kids are going to stay in school. Kids are going to stay in hockey. It's going to be safer for them to go to dance and to do all the activities that they love and that we know are good for their mental health. So the way to do that, and kind of the way out of this, is vaccination. So absolutely for a physical health perspective, but we also don't want to forget the mental health perspective and the continuation of normal things, to help out children.
And the herd immunity is important for the individuals that legitimately cannot get the vaccine. Right?
Mm-hmm. So we have absolutely, there are people in every city that legitimately have medical reasons they absolutely cannot. So that's one reason that it's our responsibility to protect these people. Then, of course, we know about the frail and the elderly in nursing homes, and most of those people have been vaccinated. They've had their third booster. Their immune systems are just old. They just don't work as well. And, through no fault of their own, they're trying to protect themselves. Dr. Sutcliffe always says, what we can keep out of our community, we can keep out of our schools. And it goes the same for long-term care. If we have low numbers of COVID in the community, that's going to mean lower numbers in schools, lower numbers in long-term care facilities, lower numbers for hockey teams. So really, we can keep it all low outside. It allows us to be able to participate in all these extracurricular things and curricular, of course, like school.
All right. So here are a list of some possible side effects.
Yeah. So most common side effect is pain at the injection site. And I know if you read online and you'll say, how many kids experience side effects? Well, it's astronomical. It's like 75%. Well, yeah, because 75% of kids did report a sore arm. So, these are not detrimental side effects. These are just, it is what it is. And I'm honest with kids when I say, yeah, it's going to hurt. It takes 2 seconds. It feels like you're getting a mosquito bite. So pain at the injection site is absolutely a possible side effect. It's very more common rather than not. I do see a lot of tears in my clinics. What we can see and what parents may have noticed with themselves if they were vaccinated is headache, fatigue, muscle pain, maybe a fever. These things are all generally mild, but like we said, COVID doesn't discriminate against who gets sick. The vaccine is the same thing. Two people getting the exact same thing, one might be down for 48 hours and the other one might say, I'm fine, my arm's a little sore. And I've heard in the clinics, everything from, soup to nuts. Some people say I was great. I went for a run after, I felt fine. And then we've heard from healthy, adult men who are like, I was on my butt for 3 days. I couldn't get out of bed. I felt so sick. So what we want to tell people, it's kind of like, it is what it is. Sorry, it's not operator error. There's nothing wrong with the vaccine. There's nothing wrong with you. Unfortunately, that's just the way it goes sometimes. And then side effects from one dose certainly don't mean you shouldn't get subsequent doses. So if you had a fever after dose 1, it doesn't mean you're going to get a bigger fever after dose 2. You might, but unfortunately, we really don't have a great way to predict the side effects. So I have 2 children, both were vaccinated, and one complained, the other one said she was perfectly fine. So there's really no rhyme or reason. Some people are affected differently. I myself have had 3 doses. I've been fine after all 3.
Right.
So maybe I'm just lucky.
We had the same thing in our family, right? So I the second dose put me out for pretty much the day. Second dose for my daughter as well too, but my son was fine after both and my husband was fine after both. So like you said, it's hard to predict. So
yeah.
So not listed on your side effects here, because these are the mild to moderate ones. There is a question about myocarditis. And then I guess in the survey, it was also pericarditis was also mentioned. So what is this risk? And is it significant for the children?
So I would say not significant for 5 to 11-year-olds. Certainly something to be concerned about. So we absolutely will ask when I'm screening parents before I immunize. I say, has your child ever had any heart issues? Try to have just an easy way to kind of ask, and do we need to dig deeper in it? Has there been a history before? When the myocarditis and pericarditis stuff came out, it was predominantly for young men ages 18 to 24. And that was kind of our group that we were really concerned about, and more so with Moderna vaccine than with Pfizer. Not to say that, it hasn't happened, because absolutely, but we have followed up. And I don't know if I talked about this, but another important thing is public health absolutely follows up, whether you call to say, I got my vaccine and then I stubbed my toe, or, I was severely sick. So we absolutely follow up on all complaints of adverse events. We follow up with the physicians. If someone said, I was having chest pain, I had to go to the hospital, because of course that's happened. And absolutely that is all followed up with. All the side effects are reported back to the ministry and back to Health Canada. So we're certainly on it, but for the children, no, they're at no greater risk. There have not been any reports of myocarditis in the 5 to 11-year-olds.
And what do you recommend for if your child or your children have allergies? So Shannon actually was asking about peanut allergies, or anybody being anaphylactic to things. Like, what is your recommendation if you have a history of allergies?
Yeah, so we would certainly, that's also another question I ask before administering any medication. And then we talk about what the allergies are. So if someone has an egg allergy or a peanut allergy, which are what we often will see with children, vaccine is not made with peanuts. It's not made with eggs. Some parents are nervous because at one time there was a correlation with eggs and flu shots. So for sure, we'll chat about it. Kids will yell, and I'm also allergic to dogs. So we're certainly happy to entertain that, but no risk for food allergies at this point. Someone would have to have a specific allergy to a specific component of the vaccine. So for adults, polyethylene glycol was one of our questions, and that's the dye used in dye tests when you're at the hospital. So we would follow up with that. And certainly, the rule of thumb is, if you're not sure, then you don't give it, right? We would look for an allergy consult. But so far, I haven't had to defer any kids because of allergy concerns. So, yeah.
Is there a concern with fertility after the vaccine?
No, so nothing in the vaccine is hormonal. So there's nothing for us to think that there would be hormonal side effects or fertility side effects for women or for young girls or for young boys. So nothing with that.
And then again, this is sort of, I guess, long-term versus short-term side effects. So somebody was asking about long-term side effects. It was also a question that was asked in the survey. Are there long-term effects with vaccines?
So, I mean, with COVID vaccine, we've been giving it in Canada for actually, I think today was the 1-year anniversary. We started in Sudbury in January, but I think so. I mean, like I said, Health Canada is continuously monitoring, continuously following up on reports. This data is only a year old. So, can we talk about 20 years of data for this particular vaccine? No, we can't. But what we do know, and what I talked about at the beginning, is that this technology is not new. These vaccines did not come out of nowhere. These are the world's top doctors and scientists who have made this. So I think we need to trust that they do know what they're doing. And it's, vaccines have been around for a long time. And, could there be potential side effects? Could there be the odd trouble? Maybe. And that's why parents have the decision whether or not it's right for them. Our firm stance is that the benefits far outweigh the risks. And we also don't know the long-term effects of COVID. So we talked about long haulers and we talked about people with reduced lung capacity and all that kind of stuff. And so it really is an educated and an informed decision on what's the best for you. But I do like to reassure people that, these vaccines didn't just get plucked out of the air. They absolutely were appropriately studied by all the, the best people in the world. And we have full confidence that they're more beneficial than not.
And historically, vaccine side effects of vaccines are seen in a very short time period within having had the vaccine.
Yeah, so that's one of the reasons we ask you to wait for 15 minutes. So I will say, and I don't know that I should say, but I will say that, we've given over 300,000 adult doses of vaccine. I feel like I've been present for every single one of them. And we had one lady have an adverse or an anaphylactic reaction. And this was a lady with known allergies. She showed up to the clinic with her epi, was expecting an allergy. And so she did have an anaphylactic allergy, but she's anaphylactically allergic to many medications. And so this wasn't an unprepared situation. But out of 300,000 doses, it happened once. So that's fairly comforting. And that's why we tell you to wait, because we know that emergent adverse events are going to happen in the first few minutes. And no adverse events with kids. So we've been doing kids now, I think 2.5 weeks. Lots of tantrums, lots of tears, but and lots of wonderful, brave children as well. But no adverse events.
And they've been vaccinating in the United States for longer.
Absolutely.
And they also have had no significant adverse effects as well.
Mm-hmm.
All right, so let's move on to how to talk to your children about getting the vaccine.
Oh, this is one of my favorites. Please talk to your children about it before you come. I can't tell you the amount of times I've had people sit in my chair and the parent says to me, "Oh, she doesn't know why she's here." And I'm like, okay, this isn't going to help anybody. So be prepared, prepare your children. I mean, getting vaccinated is fantastic. We're so happy that you're here. Don't make it a scary secret. Like, by not talking about it, maybe your children are going to think it's scary or it's bad, or, so talk to them. Kids want to be part of the solution. Kids know about COVID. They're wearing masks in school. They're sitting behind plexiglass. So this is not polio or diphtheria that they don't know. Kids know what COVID is. They don't like it. And, they want to be part of the solution. So absolutely chat with your kids before you come. See how they're feeling. Like, are they excited? I had one daughter that was kind of, and then another one that was so excited to get done. So, see where they're at. This is a big deal. This is a great and happy day. I say to parents, when you're finished, take pictures of your kids with their vaccine receipts in the car. This is exciting things and kind of like, I don't like to say normalize it, because we know nothing with COVID is normal, but make it a good thing. Don't make it a secret, and don't not talk about it and make it scary. Like, this is a great thing. And, we're lucky we live where we do and we have access to vaccines. So absolutely prepare your child as best as you can, and chat with them. And trust me, it makes for a better experience than when they show up with no clue.
And we'll move on to the card system.
Yeah, so these are just a few little tricks. Comfort your child, ask your child if they have questions. Distraction is a great thing. The relax is actually for the parent. So we know that parents are not all fond of vaccines. Needle phobia is very real, and it is a real fear for some people. And we know that. And we see parents who come and they're scared, and then their kid is nervous, and, it just doesn't go always the best. And so what we like to say to parents is try to prepare yourself as well. The good news is a lot of parents have been through the vaccine clinic process. So it's, if you're coming to a gymnasium or an arena, it's a great, big, loud environment. So just try to prepare yourself, try to prepare your child. It's fast. You're not going to be here all day. And 9 times out of 10, the calmer the parent, the calmer the child. And, sometimes what we see, and often we see this with infants, not so much with COVID vaccine, where the mom can't do it or the dad can't do it. And so they bring the grandma or they bring the aunt because they just don't want to see their child cry. And that's okay. If you know that I'm not going to be able to sit and hold my child, it's too hard for me, absolutely bring a grandparent or a friend or a neighbor, or bring someone with you to help you through it. Because if this is your fear, and, we want it to be as pleasant an experience for everybody as possible.
Excellent. All right. And so vaccine opportunities that will be coming up in the near future.
Clinics are happening on the daily. I just heard this afternoon there was an announcement from the ministry, an even bigger push. So most people are familiar with our mass clinic settings, which are in arenas. Things have changed a little bit since hockey started, but we do still have in Sudbury Carmichael Arena. We have a few clinics in after school, so in school settings that children would be more familiar with. You can also try to reach out to a pharmacy. Some family doctors and nurse practitioners are offering it. Important to note that we are trying to keep up with the demand, and we're adding clinics every day. So we know that boosters for adults have come out, so that took a lot of vaccine spots, but we do have spots reserved for children. There are lots of appointments for children still available. So if you can't get one at your preferred time, you can always check the next day, as new opportunities are always being added.
So when I went, I think I only booked one of my vaccines, and then the rest of them were walk-in. Are we moving more towards booking now? Is that the way it's working?
So right now, the bulk of the appointments are booked appointment only. And that's only because with the reintroduction of the age group, so now that some people are still getting first and second, some people are getting boosters, it's just getting too busy. And with the older adults needing boosters, and it's winter and we don't want people waiting outside, it's a good problem to have. We were just way too busy. And so, kind of the fairest way is by appointment only. There are a few of the school clinics we're allowing drop-ins, because sometimes for kids, booking an appointment and keeping an appointment just isn't feasible. For some families, they need a drop-in situation. So we're trying to accommodate as best we can, but I would say more often than not, appointments are preferred.
All right. So we took a little bit longer doing the presentation because we were answering questions within them. So we do have sort of a section for question and answering, and most of the starred ones that have been sort of highlighted for me, we've answered. There is one about age. So Melissa was asking, said her child is turning 5 next year, and wanted to know how soon after they turn 5 should the child be vaccinated?
Yeah, so that's a great question. And for January, we get this question a lot. We don't have the answer yet, so it hasn't been confirmed by the ministry. I can tell you that what we're doing right now is if a child is turning 5 prior to December 31st, we are immunizing them. So, we're seeing a few kids that are now 4 years, 11 months. And we do have the medical directive for that. So they're not quite 5, but they're turning 5. It's kind of how it rolled out at the beginning. If you were turning 80, then you could get it. So we don't have the answer yet, but we will definitely have it before January 1st. And then a decision will be made at the provincial level. Either you have to be 5 on the day your bum's in the chair, or, goes by birth year. If you're a 2016 baby, then, after January 1st, you're eligible. So we're just waiting for that. And I'm not sure kind of which way it's going to go.
And then on the reverse side, what do you suggest for children that maybe got their first dose at 11 and then had a birthday and turned 12? Should they stay with the pediatric dose for that, or
no? So for those children, the vaccine. So our medical directive, you need to be 11 and 364 days to get the pediatric dose, and on the day you turn 12, it automatically bumps you to the adult dose. Now, for some people, that's a little tricky because is your immune system really 3 times more mature today than it was yesterday? But, we need cutoffs and we need guidelines, and that's the way it goes. So it's the age that you are on the day of the clinic.
Do you think that we're going to be doing 3 third doses for the younger groups as well?
I have no inside scoop on that one. If I had to put money on it, I would say probably. That's just my best educated guess. Of course, that information will come down from Pfizer itself, from Health Canada, to Public Health Ontario, and then Dr. Sutcliffe will give us the direction. But if we just look historically, we see that boosters are beneficial to other age groups. That seems to be the trickle effect. And now we're, the recommendation in January is for boosters in those 18 plus. So I think they'll give it some time, but I wouldn't be surprised if they're looking for a third dose for the younger kids.
There were a couple of people wanted to know what was the percentage of efficacy for the vaccine in the children's age group.
Oh, I'm sorry, I don't have that.
I don't think I have that either. I think it was like, the initial vaccines were in the 90s, but that was for the very first SARS-CoV virus.
So we don't, I don't know that we even have the data yet. I would assume it would be similar to the adult data, but we haven't been given anything as of yet.
Just trying to think. A lot of these questions, some of them have been, somebody is asking about travel. Will my double vaccinated child still have to isolate 14 days after international travel?
So that's a tough question for me to answer, only because the guidelines change so quickly, and I can appreciate how frustrating it is for families, because it's equally as frustrating for nurses. The ministry changes the guidelines. This virus is nuts, and as it continues to change, we have to change with it. And our best medical and scientific minds are making these recommendations based on what we know today. If the virus throws us a curveball, there's a new variant, we need to change. So I tell people, and travel is a common question, especially at this time of year. I also am hoping to leave Sudbury for a week or two. So it's kind of a last minute decision. I say it's a game day decision. I tell people, plan as best you can, protect yourself, of course, by getting your vaccines as far ahead as you can. Get good travel insurance, because we really that's unpredictable. Who knows in a week from now, in a month from now, what the travel restrictions will be.
Before we get to, I've already flipped the slide to where we can get more information. One last question, which I'd seen earlier and I was going to ask, and then I forgot. Somebody had asked if a child, or I guess even if an adult, has been sick with COVID, how long do you wait until after you've recovered before getting the vaccine?
So great question. And we've seen a ton of COVID positive patients at our clinics once they've recovered. There's no strict rule. The rule of thumb is you absolutely have to be cleared from isolation by public health. So for most people, that's 10 days from your diagnosis. And then we want you to be feeling better. So, 2 weeks, I would maybe say. There's no hard and fast rule, but absolutely clear from public health, and just make sure you're feeling better. I mean, if you're still feeling absolutely lethargic and run down and you still have this persistent cough, then, that's not the best time to get your vaccine. But we absolutely have given it to people, I would say, 2 to 3 to 4 weeks after diagnosis. So it's not a long waiting period. It's public health clearance, and then as long as you're feeling up to it.
Right, because I think you had said 90 days was like for it to clear the...
Yeah, so we certainly we're not recommending people wait 90 days. We still say, as soon as you can, get vaccinated. So I would say, and we have done a few kids in the last couple weeks that I also do some case and contact work. So I'm like, hey, weren't you just positive? But, if the child is feeling up to it, same goes for adults. You're cleared, you're feeling up to it, then absolutely come. Don't delay.
All right. Well, thank you so much, Carly. On the screen, we've got some websites that you can access for more information. And if you want to forward your any questions, I guess, is there sort of a contact information on the Public Health Sudbury District?
Yeah, people can email in. I'm not sure exactly how it works, but absolutely on the main Facebook, or not Facebook, but on our main website page, there are people who monitor that daily, and absolutely will respond to your questions as best we can.
All right. Well, thanks. And hopefully we answered some questions for all the parents and guardians that are out there that are concerned, and we'll get a nice turnout for our child vaccinations coming up in the next few weeks.
Yes, we're looking forward to it. We have a big push on the next 2 weeks, so we're looking forward to seeing everybody.
We have 3 clinics that are going to be happening at Science North over the holiday break. So 22nd, the 29th, and the 31st of December.
Super. Well, I'll be there with my needles ready.
Awesome.